Hello, my name is Moira MacLeod. Sitting with me here today are two of my colleagues, Kirsten McCallum and Mary MacDonald. We are all community psychiatric nurses based in Skye and Lochalsh. I am based at Portree Hospital and cover the north of the island. Kirsten is based in Broadford Hospital, covering South Skye, and Mary is based in Kyle GP Surgery and covers South Skye and Lochalsh. Okay, so what do? Well, we can provide perinatal health care to women who have experienced or are at risk of mental health problems either before, during or after their pregnancy. According to statistics, between 10 and 20% of women develop a mental illness during pregnancy or within the first year of having a baby. Depression and anxiety are the most common mental health problems experienced during this period. As we're all registered nurses, we work within national guidelines, NICE and NMC, the Nursing Midwifery Council, and you'll see on the video link below. During routine appointments with your midwife, all pregnant women will be asked about past or present severe mental illness. For example, if you have in the past suffered from schizophrenia, bipolar disorder, psychosis or severe depression. You will also be asked if you have ever had contact with a community mental health team, a psychiatrist, or had any inpatient admissions to a psychiatric hospital. Women who have a history of mental health problems are more at risk of relapse when they become pregnant, especially if they stop their medication. Causes of perinatal depression are often associated with a dramatic change in hormone levels. This may be during pregnancy, but may occur following the birth of your baby. It can also be due to sleep deprivation and also the psychological stress of new motherhood. We accept referrals from your doctor, your midwife, your health visitor, or any other health professional. We would then contact you by letter and offer you an assessment visit. This could be at your home or in a clinic setting, for example at your local hospital or your GP surgery. Depending on the outcome of that assessment, a care plan would be agreed upon. It may be that our involvement would be a brief intervention, but it could be that we would remain involved until after your baby is born. In Highland, we have over 2,000 births a year. Of this, 34 women will be existing users of mental health services. 4 of these 34 may require admission to a psychiatric hospital due to a very serious but rare condition called puerperal psychosis. 300 will also experience postnatal depression, that is those that have been diagnosed, and also another 200 may experience temporary emotional distress, for example an anxiety disorder.
So just to recap, perinatal mood disorder during and after pregnancy is not unusual. It can vary from the very distressing but time-limited baby blues, which may only last a few days, to a more severe mood disorder. Antenatal depression affects 1 in 10 pregnant women. This peaks at around 32 weeks of pregnancy, and normally anxiety lowers following the birth. Baby blues affects 50 to 80% of new mums. Symptoms occur and pass within 7 days following the birth. Symptoms are cheerfulness and emotional lability. Postnatal depression affects 10 to 15% of women in the first year following childbirth. This is 3 times more common among teenage parents. Postnatal depression may occur immediately after the birth or any subsequent births. It is treatable, but early diagnosis improves the outcome. Puerperal psychosis, 1 to 2 postnatal women per 1,000 are affected. If previous puerperal psychosis, then there is a 25 to 55% risk of reoccurrence. Symptoms can begin during pregnancy, often when a diagnosis of psychosis is already present. The onset is rapid and the symptoms include loss of contact with reality, hallucinations, severe thought disturbance and abnormal behaviour. But on a more positive note, treatment started early will have a positive result. Treatments can be a combination of interpersonal therapy or one-to-one talking therapy, medication, having me time, such as on the relaxation video, and promoting physical exercise and a healthy diet. There are also a number of websites available on the video description below that you may find useful, such as Breathing Space and Mood Juice.
Hi, I'm Mary MacDonald. My role as community psychiatric nurse includes working with people with addictions. I cover South Skye and Lochalsh. My colleague Diane Williams covers the addiction service in North Skye. I'm going to give you a brief overview of who can be referred to the addiction service and how we work with people with alcohol or other substance abuse or dependencies. If you are planning on getting pregnant, then stopping all substances is best. However, abruptly stopping heavy use of any substance can cause problems, so you may be referred for a specialist assessment. If you are pregnant and using drugs, alcohol or any other substances, and your midwife or your GP is not aware because you are too worried to tell them, they will not be able to offer you or your baby the best care. If you have been drinking heavily or using drugs before you realised you were pregnant, don't panic. You may not have done any damage. Since almost all drugs pass through the placenta and reach your baby, we must consider that drugs unsafe. This includes cigarettes and alcohol. Some drugs reduce the oxygen your baby gets. In early pregnancy, drugs such as alcohol affect your baby's development. Your baby may not grow as well as expected. Taking drugs may also cause problems in the latter stages of pregnancy and affect how the placenta works. If taking drugs such as opiates or benzodiazepines, your baby may suffer from withdrawal symptoms, be distressed when born, and need to stay in hospital for assessment of withdrawal symptoms and require medical treatment. Referrals can come from anyone: other health professionals, social workers, GP, midwife, health visitors, family members, and you may also refer yourself. A drop-in clinic is held by my colleague in North Skye, Monday to Friday, 2:30 p.m. to 4 p.m. at Portree Hospital. No appointment is needed. I can be contacted by leaving a message at the GP surgery in Kyle if you would like to see me for help with any substance use. At our first appointment, I would carry out a comprehensive assessment. This would be about your current substance use, past use, and your family history. I will ask about mental health, current and past, and your general physical health. I will also ask about your strengths and what is working well for you. This process helps me to get a picture of you as a person and look at issues that can affect your health now and how to make changes. I work jointly with you, working on your plan, supporting and encouraging you, as well as offering education and strategies to stop and remain abstinent. I will continue follow-up on programmes such as buprenorphine and methadone. I will be working closely with the midwives, GPs and other professionals to assist you through your pregnancy, baby and beyond.
We're all here to help. And don't forget your relaxation.